The Health Brief on the Journal.
We're 12 minutes into 11 a.m. in Central African time. Thank you for staying with us as we, of course, have come through in the very last hour of the program for today. And we get into our Wednesday Health Brief half hour, looking at the connection between climate change and public health. Just to use South Africa as an example, climate change is not only changing our weather patterns, it's also changing and affecting health challenges, as it were, here in South Africa, that we ultimately need to prepare for, from climate-sensitive diseases rather to extreme weathers putting pressure on healthcare services. Our healthcare systems are increasingly being tested at this time. A recent publication in the Public Health Bulletin of South Africa actually highlights this very issue. It highlights climate change as a growing public health emergency and the need for stronger preparedness, surveillance, as well as coordination. So let's have this conversation, really looking at how we need to go about this. What needs to change so that we can be more prepared as climate continues to change? On the line with me, Nivashan Govender, who is Emergency Operations Manager at the National Institute for Communicable Diseases, and one of the articles co-authors, by the way. This is a very, very important article as you and I speak, because it specifically highlights the rising temperatures, the floods, the droughts, the changing vector-borne diseases, and so many things that come through there. So I'd really encourage you to give it a read should you find some time. Strengthening South Africa's public health response to climate change. It was published by the Public Health Bulletin, as I noted, here in South Africa on the 24th of July this year. So Nivashan actually joins me on the line so that we can unpack the growing link between climate change and public health. Welcome to the program, Nivashan. Thank you very much for your time.
Thanks for having me, Mitseko.
Thank you very much. When we talk about climate change as a public health issue, what does it actually mean for the ordinary South African?
For the ordinary South African, I think you've, in your introduction, you've encapsulated a lot of it. I think what we need to remember is that climate change is no longer simply an environmental issue. It's increasingly a public health issue, and importantly, a health security issue. I think people forget that component. The reason is that climate change is changing, as you mentioned, the conditions in which people live, they work, and become ill. We are seeing rising temperatures, extreme rainfall, flooding, drought, water insecurity, and changes in ecological conditions. Those changes affect infectious diseases, non-communicable diseases, nutrition, mental health, and importantly, the ability of our health services themselves to continue functioning during emergencies. So that was really the starting point of our article that you mentioned, this public health response to climate change, which we recently published in the Public Health Bulletin. And our argument is not that South Africa has done nothing. In fact, we have important climate and health policies, strong surveillance capabilities, considerable technical expertise in the country. The concern is that these pieces are not sufficiently connected. So we need to move from thinking about climate change as something that creates an occasional disaster that we respond to, towards recognizing that it is actually changing risk environment that needs to be continuously monitored, anticipated, and really managed. You referenced that article, and that was really the fundamental message of that article.
Absolutely. And I'd like us to stay on that piece of writing, because it's very important as it points to, I did mention the rising temperatures, the floods, the droughts, water scarcity, etc. Which one of these climate-related changes are already having the biggest impact on public health in South Africa?
That's an important question. And I think the thing to consider is that climate change does not necessarily create completely new diseases on its own. Rather it changes the environment, social and ecological conditions. As I mentioned in my little introduction, that actually influence existing health risks, right? So it's things that we know, but impacts that. So we already are seeing several pathways, the extreme heat that can directly cause heat exhaustion, heat stroke. It also in places additional stress on people with cardiovascular issues, respiratory issues, and other chronic conditions. So the people that are most vulnerable are often those who already have the fewest resources to protect themselves. Flooding creates another cascade of risks. Can damage water and sanitation infrastructure, contaminate water sources, displace communities, disrupt health services. After flooding, we can therefore see increased risks of diarrheal, waterborne, respiratory, and skin infections. There's also the vector-borne disease dimension that you alluded to. Changes in temperature, rainfall, standing water can affect mosquito populations and the conditions in which disease such as malaria are transmitted. We're seeing expansion of vector-borne, of the vector populations, their geographic reach. So we've actually seen very practical examples of this in Southern Africa this year alone, following unusually heavy rainfall and flooding earlier this year. Malaria increased in parts of the region. South Africa reported increased malaria activity, particularly in our malaria endemic areas, which I'm taking this quote from, in Limpopo and Mpumalanga, in January compared to last year, for example. So the NICD also reported that heavy rainfall and flooding created more favorable conditions, for this type of malaria transmission and mosquito breeding. So that is what climate-sensitive public health risk looks like in practice. There are other pathways. Drought can affect water availability, sanitation and food security. Heat, changing rainfall can affect agriculture, nutrition. Wildfire smoke and poor air quality can worsen respiratory and cardiovascular conditions. Extreme events can cause displacement, loss of livelihoods, psychological distress. The article therefore argues that climate change has to be viewed much broader, with this health lens, not just about infectious diseases. It has to include all these different indicators and aspects.
Right. Very, very important. 19 minutes into 11 a.m. in Central African time. On the line with Nevashan, who joins us to help us understand, the link between climate change and public health at this time. He joins us in his capacity as Emergency Operations Manager at the National Institute for Communicable Diseases and a co-author of a very important article titled Strengthening South Africa's Public Health Response to Climate Change.
This Women's Month, we lift our voices in honor of our queens. Channel Africa. The voice of the continent, now online, with all your sports fixtures, lifestyle, and more.
Ritmos e cultura. Com Jacob Tivani. Ora, calorosas saudações, fiéis ouvintes do Ritmos e Cultura. Hoje celebramos não só a música, mas também a persistência, criatividade e paixão que continuam a inspirar gerações de músicos e ouvintes, não só em Moçambique, em África e no mundo lusófono. Ladies and gentlemen, senhoras e senhores, o conceituado Aniano Tamele in the building.
Bilwini kamina kuna tepu la kupima ilona kuva utasona swakunzi kuranza kanjani. Bilwini kamina kuna gezi la kuva ningela.
Ai! Ritmos e Cultura com Jacob Tivani. Todos os domingos das 20 às 21 horas.
The Health Brief on the Channel.
Right, a few more minutes in and we continue with our health brief half hour here on The Journal, as per every single Wednesday, exclusive to The Journal. On the line still with Nevashan, who joins us to help us get an understanding of the link between climate change and public health at this time. Nevashan, you mentioned explicitly in the last segment around, climate change and the fact that it's not inventing anything new in terms of diseases. There are no new diseases necessarily, but it is influencing the spread of disease at this time. I would imagine that this is putting quite a lot of pressure on, hospitals and emergency services at this time. How prepared are we as a health system to be able to deal with such events that are coming through frequently, I would imagine, and with a lot of intensity?
Yes, I mean, these events, because the health trajectory usually unfolds over days, weeks, and sometimes months. In particular with South Africa, I would describe South Africa as having significant capability, but there's also significant gaps in our integration. We have really strong institutions. We have the NICD, provincial epidemiology teams, laboratory surveillance, the notifiable medical condition surveillance system, environmental health services, disaster management structures, really good academics at universities, the South African Weather Service, many other technical capabilities. So, for example, routine national surveillance is already generating substantial amounts of disease information. The NICD's current surveillance reporting includes thousands of notifications across multiple conditions and provides information on disease trends, laboratory confirmation, and the geographic distribution, which is really important in understanding what's happening. So the problem isn't that we don't have surveillance. The problem is that, much of our surveillance is still organized around detecting disease rather than anticipating risk. And that's the distinction that's extremely, extremely important. If we wait until we start seeing patients arriving at hospitals with diarrheal disease after a flood, for example, we are already responding. We're not being proactive and prepared or in a state of readiness. So, but if we know that an extreme rainfall is forecasted, that flooding has occurred, that a particular water system has been compromised, and that a vulnerable population is going to be affected, we should be able to act before the increase in disease occurs. That is the transition we need to make. So we need to be able to move from surveillance of disease to surveillance of risk. Again, going back to that article, the article found that surveillance for climatic sensitive diseases remains fragmented. While diseases such as malaria have established surveillance systems, surveillance for other climate sensitive threats, including things like Rift Valley fever, leptospirosis, and many waterborne diseases, can be inconsistent and may be strengthened only once an outbreak occurs. So, in the emergency, we're looking to strengthen. We also identified that we have limited integration of our meteorological and environmental information into our routine health surveillance and early warning systems. So I wouldn't say that South Africa is starting from scratch. I would say that we have many of the pieces. The real challenge is connecting the pieces, turning that information into anticipatory action as opposed to a knee-jerk response when we have an emergency.
Right. I think it's worth also noting that climate change does not affect everybody equally. I mean, I think of an example of Quarry Road West, informal settlement in Durban. Research there has found that floods can spread, populate and pollute the water there in those particular settlements. And there's so many other examples that we can note at this time. But let's talk about the vulnerable communities that are needing a lot of urgent response for what is happening at this time when we look at climate change and public health services.
Yeah, it's really important for us to be able to understand who these vulnerable populations are, what what the infrastructure challenges are, what the effects have been on climate, of climate-related events in those areas. What have we learned, from those events, and what mitigation mechanisms have we put in place? How are we working with the communities to be a lot more proactive? There are many things that communities can be made aware of. For example, when you have predicted flooding events, you could always evacuate, communities in advance. And in your response, in your preparedness, you could always make available pre-planning for available of wash services, so that adequate water and sanitation following an event to interrupt or even not interrupt potential transmission of diarrheal disease, for example. And the flooding in KZN is a really good example that you drew to. They had flooding events in KZN for 2 consecutive years. The consequences, where you have your initial trauma and drowning and deaths, you have displacement, and then obviously overcrowding with these displaced people. Then the water and sanitation systems are compromised, and there's always the risk of diarrheal or other waterborne diseases. But what we also saw, in particular in KZN, is that because of the infrastructure damage, environmental changes that create favorable conditions for disease, for vectors. So it's not simply a disaster event. There's always the possibility of a public health consequence as a result. So understanding the resources that are available, identifying your vulnerable populations, and mitigating as much as possible proactively is really the key.
Very, very key. Nivashan, thank you very much for the time. I think you've given us quite generously a lot of information on what is happening and deepened our understanding with relation to climate change and public health. Thank you very much for your time.
Thanks for having me.
Thank you. Nivashan Govender, Emergency Operations Manager at the National Institute for Communicable Diseases and a co-author of a recently published article, which is titled Strengthening South Africa's Public Health Response to Climate Change.